Thank you.
Díagwit agus fáilte go dtí an Every Move Counts webinar and you. We're delighted to have so many of you join us today. Over the next hour, we're going to share some updates with you on the Every Move Counts National Physical Activity and Sedentary Behaviour Guidelines, new resources to help you communicate and share the guidelines, as well as tools to promote physical activity. We're also really pleased to have a number of colleagues here with us from education, sport, transport, to chat about the forthcoming National Physical Activity Framework and Action Plan and their hopes for the physical activity policy landscape over the next few years. Achanish Bawalam Fáilte Curriv, Minister of State, Deputy Jennifer Murnane O'Connor.
Good afternoon, everyone, and thank you for inviting me to address the opening of today's webinar. This event is well timed as we will very shortly be launching the new National Physical Activity Framework and its first action plan. These will set us on a pathway out to 2040 towards becoming the most physically active population in Europe. These are our successors to the first National Physical Activity Plan, which was published in 2016. An independent review of that plan in 2021 found that the majority of its 60 actions had been completed or substantially progressed. In particular, the review highlighted our successes in building a collaborative approach to the promotion of physical activity in Ireland. Understanding that represents a healthy level of physical activity for the full range of ages and ability in our society. It has been crucial to inform our physical activity objectives and policies. The publication in 2024 of Every Move Counts, the new National Physical Activity and Sedentary Behaviour Guidelines for Ireland, brought Ireland in line with the updated WHO recommendations on the physical activity. This year has also seen the conclusion of that body of work, with the publication of the additional guidelines for pregnant and postpartum women and those living with a chronic condition. Together, these are essential documents which will be of enormous benefit to us as we begin to implement the new framework and action plan. International data already indicates that Ireland's physical activity levels compare well with other European countries. The 2022 Eurobarometer report showed that 14% of Irish population engaged in physical activity 5 times a week or more, compared to the EU average of 6%. In the coming years, we will continue to work across sectors to develop the full suite of physical activity supports informed by Every Move Counts to target all age groups and all sectors of society. We will rely on consistent and coherent policy responses across a broad range of stakeholders, informed by best practice on physical activity which delivers the best health benefits. The drivers of the behaviour change are complex and challenging. This is why we are aligning the long-term goals of our new framework with shorter-term action plans. The first National Physical Activity Action Plan will cover the period to 2029 and sets out 59 commitments across a range of stakeholders. These will build on the progress made to date and further increase population levels of physical activity. The information, advice and public message contained in Every Move Counts guidelines will be a core part of our work in promoting physical activity in the coming years. These guidelines are for everyone and can encourage all our citizens at every life stage to undertake some physical activity and avoid sedentary behaviour. I have no doubt that today's webinar and panel discussion will provide a great opportunity for all taking part to discuss how we can make the best use of the guidelines and continue to encourage people towards healthier behaviour. It only remains now for me to thank you again for your work and to wish you all an enjoyable and productive discussion. Thank you.
Na buntáiste bhána le bheith gníomhach. Má bhíonn tú gníomhach, ordinn se de humor, leidinn se stras, cudinn se leat colla níos fearr, féidann se cabhar leat dáibh a chathú le daoine eile. Bíonn tú níos láideire agus níos solúpa de réir mar haon tú níos, agus leidinn se de rusca galar. Má tá roch sláinte ort, féit a cuineal gníomhach de chaidán síl a ausú go mór agus na symptóim a bhuialú. Cebi acu siúlóid, ri, rang acliachta, dausa, garidóireacht nó sporta immert is in eisteacht á chur leatib gan buga I de chláinte agus fulla na jaarhermach agus adhermach. Thugan tám gan na fása de chláinte agus de uláine a estrian as a bheith gníomhach a chuirt faoi dara, féite se sin cabhar leat a chuineal spreaga. Is fiú gach éireacht.
Gurmagus, Minister, and you've just seen there one of a suite of videos that we have produced and will have available shortly, and you'll see some more throughout the session today to promote the guidelines. The videos have been produced in both our official languages, Irish and English. So I suppose I see there's a question in already from one of the participants around whether the video or the webinar will be available afterwards. It is being recorded, and a link to the recording will be sent out to everyone who has registered for the webinar. So I suppose just to get started then, I'm just going to bring up my slides there and just give you an update on some work we've been doing over the last little while to implement the guidelines and make them a real live living document. The World Health Organization, I suppose, considers national physical activity guidelines as an important policy tool for countries to have when they're aiming to improve health and well-being and increase population physical activity levels. As the Minister mentioned, last year we published the Every Move Counts National Physical Activity and Sedentary Behaviour guidelines, and these update the first ever guidelines for Ireland that were produced in 2009. In fact, those 2009 guidelines predate any World Health Organization guidelines. They cover babies, children, young people, adults, older adults, and people living with disabilities. And the guidelines put an equal focus on both aerobic and muscle strengthening activity across the week, as well as limiting sedentary behaviour.
Sarah, apologies. We weren't able to see your slides there, so Dana Marie has shared up the slides. So if you want to ask her to move the slides along, she can do that.
Okay, great. I'll just go back into the screen perfectly. Brilliant. So sorry, Dana Marie, do you mind going on to the next slide? Yeah. Perfect. So these guidelines, the general Every Move Count guidelines, as well as covering the population groups that I mentioned, are informed by they've been informed by the current World Health Organization guidelines, and uniquely the document itself contains a suite of key messages for people working in many sectors, including health, education, sport, local authorities and others, on the importance of promoting physical activity and on taking action to promote physical activity. So if you move on, Dana Marie. As the Minister mentioned, we also have done some work to develop guidelines for two particular population subgroups from a health service perspective. I suppose there are two groups within the population that we have a lot of contact with, and those are people living with chronic conditions as well as pregnant women. So we've done this work working with an excellent team led by Professor Michael Harrison in Southeast Technical University. So we have our guidelines for chronic disease, and if you flick on, Dana Marie, also the guidelines for pregnant and postpartum women. Both sets have, the detail and follow the same structure as the original guidelines and have accompanying infographics to communicate the key messages there for the pregnancy and postpartum phase, I suppose, as well as the aerobic and muscle strengthening and limiting sedentary behavior messaging. There's also some key messaging there around incorporating pelvic floor muscle exercises throughout the week also. If we move on. So now we have a full suite of guidelines covering the whole of the population. One of the things we have been also doing in the last 12 months is communication and dissemination, trying to bring awareness of the guidelines to as many people as possible. We got really good media coverage when we launched in March last year. And also the really popular HSE Talking Health and Wellbeing podcast, episode 68, focuses on the guidelines. So that's a great resource for us to have. We've also updated all the HSE public information resources to reflect the guidelines. So those would be the online resources, and also as print resources are being reprinted, that content is being updated. And our colleagues in health promotion around the country have also been are also busy raising awareness of the new guidelines. In August this year, I was joined by Darrell McDade from Donegal on an episode of Supercharged with Anna Geary to speak about the guidelines and physical activity in young children. And they're just recently, Daniel Russell and the team in Dublin Midlands featured the guidelines in resources that they've developed to promote a physical activity pathway locally. If we move on. So we now as well have a page on HSE.ie which will work as a hub for us to pull all the content together around the guidelines, the resource, the guidelines themselves, as well as the resources we've produced to help you promote them, including the videos. They're not there yet, but they will be there in the next few days. We move on. So we've also done work to update the well-being through physical activity training and the accompanying resources. So this is training that health promotion officers across the country deliver to teachers on an annual basis. So it's really great to have both the guideline messaging and also the visual link to it, to them integrated there now. This training is part of a suite of training delivered by HSE and Health Promotion and Improvement that supports schools to implement the Department of Education Wellbeing framework. And we're seeing that lots of organisations outside of the health sector, partner organisations, are also updating their resources and materials to communicate the Every Move Counts guidelines. So this is an example here from Get Ireland Walking, who run a 21-day walking challenge. So they've updated their challenge card to include the guideline messaging. So again, it's around, having that consistent, clear messaging across all sectors to promote and communicate the guidelines. Next, we've also been taking every opportunity through national conferences across the health sector to bring awareness of the guidelines more directly to clinicians. And we had posters at the Child Health Conference earlier this year, and also at the recent Integrated Healthcare Conference. And our academic partners from the University of Limerick and South East Technical University, who developed both sets, the three sets of guidelines for us, they have had abstract submissions and posters and presentations at the recent Health Enhancing Physical Activity conference in Lithuania this month. So I suppose the last but not least, I suppose we have a new set of guidelines now. While muscle strengthening was always in, and sedentary behavior were to some extent always in the 2009 guidelines. These new guidelines bring them very much front and center and on a par with the aerobic guidelines that people would have been very familiar with. And we have guidelines for additional population groups as well. So it's timely for us to look then at how we are measuring and monitoring prevalence of physical activity across Ireland. So we last year, on behalf of the Department of Health, commissioned a team from UL to look at how we develop best practice guidelines in on the measurement of physical activity prevalence in the Republic of Ireland in light of the updated guidance. So that project is well progressed at the moment. The desktop research and has been complete. Draft guidelines prepared for consultation, and 2 weeks ago we had a super stakeholder workshop with input from the major research institutes and national surveys across Ireland, and that final document is due towards the end of this year. So I suppose just to wrap up, there's been a lot done in the last 12 months, I suppose, to build awareness and recognition of the new guidelines. There's a lot more to do. Everyone here on the webinar today will have opportunities to communicate or promote these guidelines in their work on an ongoing basis, and we really encourage you to take those opportunities and to do them. Use the resources that we will have on the hub on HSE.ie, and if you need any support or have any other ideas around how we might continue to create awareness of the guidelines, please do reach out to us. So I'm just going to wrap up there and leave you with another one of that suite of videos.
Physical activity guidelines. Physical activity is good for your health. Ireland's physical activity guidelines include aerobic activity, muscle strengthening exercises, and limiting sedentary behaviour. Aerobic activity can include walking, running, cycling, or swimming. The physical activity guidelines say that you should do at least 2 hours and 30 minutes of moderate intensity aerobic activity each week. Moderate intensity activity is when your breathing and heart rate increase, but you can still talk. You can also reach the guidelines by doing at least 1 hour and 15 minutes of vigorous intensity activity each week. Vigorous intensity activity is when your breathing becomes heavy, your heart rate becomes faster, and it's hard to talk. You should also do muscle strengthening exercises on at least 2 days a week. This can include Pilates, yoga, an exercise class, gardening. Some activities are both aerobic and muscle strengthening, like swimming and exercise classes. It's also important to limit your sedentary behaviour. Replacing sitting time with any form of physical activity benefits your health. Every move counts.
Great. So I suppose the guidelines themselves are one policy tool we have in Ireland, and the Minister mentioned it earlier that arguably one of the most important ones we have is the National Physical Activity Plan. We come to the end of the first one, and we're just entering the phase for the second plan. So for now, I'd like to welcome Colin O'Hare, Assistant Principal Officer with the Department of Health, who will share some more information on the forthcoming new National Physical Activity Framework and Action Plan.
Thanks very much, Sarah, and good afternoon, everybody. I trust you're hearing me okay. I'm just going to share my slides here now and make sure that this is working okay. Are we looking at my slide deck?
Yes, Colin.
Perfect. Thanks very much. Yeah, so like I said, thanks very much, everybody, for the opportunity to speak here today. I'm the Physical Activity Policy Lead in the Department of Health, and as the Minister touched on earlier, physical activity is something of a priority for us. I'm going to get into a little bit of detail, I suppose, about how we try to coordinate policy across a range of departments and agencies on that and where we're going next on it. So I suppose, first of all, the Healthy Ireland Framework was put in place in 2013 And that was an overarching policy which set out, it developed Healthy Ireland, and it set out a range of different policy needs which would help improve population health and well-being. One of the demands from the framework itself was to increase the proportion of people who are healthy at all stages of life and to develop a national physical activity plan, which we promptly is the wrong word, which we did and published in 2016. That plan it operated through to 2022, and we've had an independent review of that, as touched on by the Minister, and that is the basis for our current policy pending the approval by government of its successor. The 2016 plan set out a range of different actions across 8 thematic areas based on the Toronto Charter. This is seen as, I suppose, best practice at a global level in relation to promoting physical activity. It had 60 actions, it had assigned leads and timeframes for these, and it established its own implementation group. What this implementation group did was it brought together 4 government departments, the HSE, Sport Ireland, the Federation of Irish Sport, the local authority sector, and it included academic representation. It also incorporated guidelines and physical activity targets for different population cohorts. So that would have been informed at that stage by the 2009 guidelines referenced by Sarah. The review of the plan found that it did a good job of developing leadership and oversight capacity at local, national, and international levels. It called for a greater strategic approach to communications on physical activity across all stakeholders. It identified the need for greater monitoring, surveillance, and coordination across our range of surveys as we track our progress towards achieving our physical activity goals. It called for the need for a more robust evaluation at regular intervals. It identified the need for a national directory of sports and recreation amenities and facilities. It called for annual evidence-based participation campaigns, and it identified the need to look at our national guidelines across all population cohorts. Where we're at now, we have developed a successor to the NPAP, and that's going to be the National Physical Activity Framework, which is incorrectly titled there, but which will operate until 2040. What that does is that's going to be a more long-term strategic document, which I'll describe in more detail shortly. Implementing that plan is going to be done through a series of action plans. So the first of those will operate through to 2029, then the second through to 34, and the third through to 2040. The first plan is currently being implemented on an administrative basis at the moment, pending the approval by government of the plan. What the framework itself does then, that gives us this high level, a long-term vision, and it's policy-based. As the Minister outlined, that seeks to make Ireland the most physically active population in the world, in Europe by 2040, across all different population cohorts. It has a specific focus across a range of different population demographics. It looks at age groups, urban, rural, etc. It is informed by global and national recommendations on levels of physical activity. It identifies the broad range of domestic policies and actors and where physical activity rests within those policies. It also looks for a strong statistical analysis of the different population cohorts and their levels of physical activity. So it provides something of a basis of that. And it sets out how we're going to assess our progress towards achieving its goals. So the first of those plans will, like I said, has been operating on an administrative basis since we finalized its text in 2024, and we're hopefully going to publish it shortly. I'll come back to that. What that's going to do is that's going to put in place the process for tracking our progress. It's going to look at the percentage of our population meeting our physical activity guidelines, and it's going to look at the effectiveness of our different policy interventions. And I suppose that first point on the population cohorts and meeting our different guidelines, I think Sarah put it well there when she outlined the range of different policies across a range of sectors where these guidelines will play a key role in what are we asking people to do and what are we tracking. And that approach will be needed across all of our sectors if we're going to fully understand our population levels of physical activity and how we take it forward. That first plan, it sets out how we're doing the governance and research as we build on the progress under the NPAP. So it establishes the role of our implementation group going forward. IPARC is Ireland's physical activity research collaboration, and that was put in place in 2017. And this new framework and action plan will embed that as the basis for linking academia and policy making in the longer term. The first physical activity action plan follows the structure of the WHO GAPA 8 areas of investment that I mentioned earlier. So again, that makes it easier to track our progress in the international stage as well. And it develops an annual reporting mechanism for physical activity, which is something we haven't had to date. So the governance of the implementation group, as I said, there's 4 government departments. It's co-chaired by the Department of Health and the Department of Culture, Communications and Sport. It includes representation from the Department of Rural and Community Development and the Gaeltacht, from the Department of Housing, Local Government and Heritage, and from the Department of Education and Youth. Yes, that's 5. It also includes the representation from the HSE, from the local authority sector, from Sport Ireland, and from IPARC itself. The guidelines then. So the guidelines, as I touched on there, provide a crucial barometer for how we're promoting physical activity, how we're achieving our objectives, how healthy and physically active our population is. It's going to give us this consistent basis across all our different stakeholders. It's going to feed into our annual reporting on physical activity. It will help inform how we compare internationally. It will help us as we, I suppose, dig into the question of what exactly constitutes a physically active population. And I even think that some of the points made in the video earlier on the guidelines give that sense of, I suppose, where the opportunities for physical activity arise and the importance of the range of different aspects of physical activity. The guidelines are also really useful in providing those targets for different population cohorts, and that helps us build our own picture of how we're progressing, which areas we're doing better in, or where we might need to work more coordinate better on. So where we're at, we're hoping to have the government approve. Like, this is going to be jointly brought by the co-chairs of the implementation group, so the Department of Health and the Department of Culture, Communications and Sport. We're hoping to bring the memo to Cabinet jointly in October, which will see these guidelines or the framework and the action plan adopted by Cabinet. We can follow that with a launch, and that's going to be carried out across a range of sectors as we look to highlight how each sector has a role to play in the promotion of physical activity. We've begun work on the cross-sectoral communications piece identified under the framework, or identified under the review of the NPAP. And I suppose the key thing is going to be that we need to start collaborating better. And that, I suppose, finishes my presentation, but touches on the need for these guidelines to be incorporated by all of the actors involved in physical activity in Ireland. Thank you, Sarah.
Gurmaga, Colin. Great to see the progress from the first plan published in 2016 to now, and it's exciting to see that long-term vision for the framework out to 2040, and the really strong focus on collaboration again. I suppose from a health sector lens or perspective, more people, more active, more often means less chronic disease, less pressure on beds, and healthier, happier people overall. But physical activity also has an important role to play in sectors other than health. So I'm really pleased to be joined now by Louise Burke, Director of Participation with Sport Ireland, Sarah Taylor, Active Transport Section of the Department of Transport, and Karen Cotter, the National Coordinator with the Active Schools Flag in the Department of Education, to chat about, I suppose, about that cross-sectoral benefit of physical activity. Louise and Sarah, I know you're both part of the cross-sectoral National Physical Activity Plan implementation group that Colin referenced. And I'm wondering, can I ask you to maybe reflect or maybe share your reflections on what you see as significant developments from your sector in recent years, and your hopes for the new framework? Louise, I might come to you first on that, if that's okay.
Thanks, Sarah. I think overall in Sport Ireland over the last few years, we've seen a huge shift in our priorities. We've looked at, we've always been the development agency for sport in Ireland, and as part of that, we look at research, anti-doping, high performance, coaching and education. The list goes on. But for us, in my very biased opinion, to be clear, the work that happens in the community and outdoor recreation has become so significantly important, especially because of that post-COVID world that we're living in. We all discovered the extent of the opportunities there are to be active, and that has definitely become a priority for us. We've worked very closely with our colleagues in the Department of Rural and Community Development, where we're leading out on a national outdoor recreation strategy that's focusing on the work that's happening and creating more spaces and places for everyone to be active. in the outdoors. It's a really exciting opportunity that we have in that strategy, and we represent, as part of that group, we represent over 40 stakeholders that are influencing outdoor recreation, from farmers to Fáilte Ireland. It's a vast number of stakeholders that are involved in that really are helping us change what's happening in outdoor recreation. Beyond that, then, again, in my very biased opinion, the work that happens in the communities through our local sports partnerships has changed as well. We've expanded so significantly into new areas with our sports partnerships because of the strength of the work that they're doing at local level in each county, and the way they're connecting in and collaborating with a range of stakeholders at local level allows Sport Ireland to deliver the priorities that are coming from not only government, but for ourselves around physical activity. A couple of areas that we really focus on as a priority is inclusion in the sports partnership. We work a lot in the areas of supporting people with disabilities, supporting people from ethnic minorities, and a range of target groups that we really want to ensure that people have the opportunity to be active at their level, which is an important part of what we do. The newer projects that we've brought in the last few years, which are in pilot phase, is that we have an outdoor recreation officer supporting the delivery of the national strategy at local level. That's in pilot stage, so there's 6 officers around the country doing that. We have a European funded officer, which is focused on integration of new communities and focusing and supporting the most disadvantaged communities in our society. Again, the LSPs are trying to ensure that everyone in their counties have an opportunity to get active. I think the one that's most relevant to this area of work, and I'm working closely with our colleagues in health and underpinning a lot of the work of Every Move Counts, is the area of physical activity for health. This is an area where we have six officers across 6 counties supporting the work that happens with people with chronic conditions. That's hugely significant. It's not an area that we had been in previously consistently across the country, but it's something that is really providing another opportunity for people with chronic conditions to find ways to be active and relieve that pressure on the health system, but also supporting people to get more comfortable in their body despite living with chronic conditions, and to find ways to get people more active more often. We have a fantastic opportunity in a project working very closely with a number of colleagues, including the HSE and the Department of Health, called Get Ireland Active. It's a website where we have a full list of all of the places and spaces people can get active. And that is such an important piece of work, because one of the biggest challenges and limitations to being active is information. And leading out on that has been an absolute privilege and challenge at times, for sure. And we're working very closely with our colleagues in the local authorities and the national governing bodies for sport to provide as much up-to-date quality information as possible on the system. And that will continue and grow. Yeah. And there's lots of potential for stakeholders to use it in the background. I think we're very lucky with the national policies that we've got in place now. As I think forward for the next couple of years, it's a really exciting time for us, because we have coordinated a huge amount of work with our brilliant colleagues in the local authorities who are creating local plans to focus on sports plans. It's really about ensuring that they're listening to their communities, they're understanding what the gap is in facilities, and that there's a drive forward, a coordinated effort with all of the partners at local level to make that change. And the exact same is happening in the county outdoor recreation space as well. So we really are such an exciting time, despite all the challenges that we faced over the last couple of years around making sure that the policies are correct and that the national coordination of stakeholders is effective. It really has happened not only through the National Physical Activity Plan framework and the implementation group, but also through the work across the government departments on an individual basis.
Yeah. And I suppose that's the piece, Louise, isn't it? It's sometimes we're all in our own little space, little bubble, looking at what's happening in our space. But when you come up and look and see the wood for the trees, it's amazing what has changed and what has moved on in the last couple of years. I was really pleased that you mentioned the local sports plans, because we don't have somebody from local authority on here to chat with us today, but that will be a significant really significant piece of work that
And
they
the
lead
work
out
the
on.
local authorities do, Sarah, is phenomenal. They are the greatest asset in the county. They are just, if once we get those plans in place, it really will make an effective change for everyone in every county in the country.
Yeah. And I'm sure, Sarah Taylor, you probably that resonates with you, because with active travel, like you work very closely with the local authorities as well. So maybe can I just ask you to do similar to Louise, Sarah, maybe in terms of reflecting on, what significant changes have happened for you over the last over the last number of years, and your hopes for the next framework.
Yeah, absolutely. Thanks, Sarah, and good afternoon, everyone. I suppose from a transport perspective, we're coming at this from a slightly different angle. Obviously, in the last 5 years, people may be aware that we've seen an enormous increase in the investment in active travel infrastructure around the country, and the local authorities, as you say, have played a huge part in the rollout of that infrastructure. Our main aim, obviously, in terms of transport, would be things like emission reduction, modal shift away from private car use, and alleviating congestion, but obviously the health benefits of moving away from car use towards walking and cycling are a happy co-benefit that resonates then with the rest of the departments and agencies involved in the National Physical Activity Plan. So that increased investment in active travel has led to us building capacity in the local authorities as well. What started out as just small active travel teams in kind of the GTA, the Greater Dublin area, and the regional cities. Now there's an active travel team in every local authority in Ireland. There's around 240 staff thereabouts, solely working on trying to improve our walking and cycling infrastructure, making it safer and more encouraging for people to get out on their bike or take that extra bit of the journey walking. We also are, very conscious of trying to target the cohorts maybe that find it more difficult to walk or cycle as part of their daily journeys. We're looking to kind of create that habit, I suppose, at a young age. And because of that, we started a new program in 2021 called the Safe Routes to School program. It is forming part of that overall infrastructure program, but it specifically targets schools, and interventions there can range from, just putting a pedestrian crossing across a busy road in front of a school to actually overhauling the outside of the school to kind of discourage car traffic and make it safer for those kids to walk and cycle to school. And Tashka and the NTA work very closely with us on that. That's just one of a number of kind of behavioural change programs as well that we're investing in. So we have the Smarter Travel program as well, which were workplaces and campuses. The NTA's team work with them to develop smarter travel plans. So that can include walking and cycling, public transport, and just try to encourage staff and also students on third level campuses to think of a different way, maybe and try out different ways of getting to and from work or college. We also have the Green Schools travel programs in schools as well, part of that overall Green Schools program, which involves kind of almost gamification of active travel measures. Like Walktober is coming up now, where you challenge to see how many steps teams can take in October, and little novel ideas like that can really help kind of galvanize people. So we have, I suppose it's a two-step kind of approach to creating the infrastructure, creating the networks, and then trying to encourage people to try it out and see if they can start making it a part of their daily routine.
Yeah, and even like as you're describing that, Sarah, that collaboration that Colin referenced at the beginning, even in your own work itself, like you're not working alone, you're working with other colleagues, other sectors. A lot of the work that you are doing there in terms of those infrastructure, and there's one or two of those Safer Route to schools in my area, so I'm very familiar with the very colorful posts and stuff. But that has, like, if you weren't doing that, it makes it harder for colleagues in education to create that active travel experience for children. And so I might just come on to Karen. They're just speaking about education. Karen, I know like you aren't aren't on the that implementation group that Sarah and Louise are, but you know, working very closely within the Department of Education with a strong focus around activity, and the Active School flag, I suppose, was one of the key initiatives called out in the first National Physical Activity Plan.
Yeah, and it was excellent to get that recognition in that first plan in 2016. I think it made a big difference to us. At that point in time, we had an accreditation process for primary schools. So they worked through a process, and if they could demonstrate to us that they were doing their best to promote quality physical education and to promote physical activity during the school day, we awarded them with a flag. So I think the target was set to increase engagement by 500 schools, and we achieved that within 2 or 3 years, so fairly fast. I think in the period of the last action plan, a lot has happened, and we've changed and evolved in lots of different ways. So I think we successfully met the challenge of COVID in that we our active school week became an active at home week, and we adapted the process accordingly. So we still have that accreditation process where primary schools and special schools engage in a process whereby we set criteria, and if they can demonstrate they fulfill the criteria, we award them with a flag. But I think we've moved, I suppose we've diversified more into national participation initiatives. So we, over the past number of years, have promoted 3 and 4 week initiatives during the course of the school year to get schools moving, because there isn't a single child in a classroom anywhere in the country that won't benefit from sitting less and moving more. And they'll benefit, their health will benefit, we know that, their well-being will benefit hugely. But also the teaching and learning benefits massively from physical activity being built into the school day. And I guess what validates our place in schools, I think, is that we're a Department of Education initiative. So from within education, we're trying to build physical activity into the school day. And I think that's significant because a lot of other countries are looking towards us for the work that we're doing. And that's probably the missing link that they don't have. It's perhaps they're trying to influence what happens in schools, but I think what's happening in schools is coming from within schools, and I think that's massive. So if I can give you an example of the participation initiatives that I'm talking about, and Colin spoke about the 8 best investments in physical activity, and one of those, I think number 1, is whole of school programs, and that's the way we approach our participation initiatives. So I think there's probably going to be a link put on screen about our upcoming skipping initiative. It's our 8th it's our 8th participation initiative, and we started off with a series of Run Around Ireland, and then we went to Run Around Europe. We tried the waters with Skip Around Europe last year, and I suppose Skip Around Europe, what it asked of schools was that every class in the school, because it's whole school engagement, would facilitate a 10-minute skipping break for every class in the school, and that 10-minute break would happen across the 4 weeks of the initiative. So we had 900 or nearly 900 primary schools sign up, 21 special schools sign up, and a reach of 165,000 children participating in skipping across 4 weeks. So it was hugely successful. So I suppose part 2 of it is coming up in October, slightly shorter. It's 3 weeks. It's called Skip Around the World. And I think the benefit of whole school processes is that they're the best investment you can put into physical activity, but they're very difficult to achieve. And I think we've learned a lot along the way of how to make it fit into the school day and the type of supports that teachers need. And I think key to that is that when we promote these type of initiatives, we're integrating physical activity with teaching and learning. So you're kind of getting a double bang for your buck during the very pressurized school day. So that's something that we're doing, and I appreciate the opportunity to make people aware of it, and hopefully some members of our audience may have children who were in schools that took part in that skipping initiative or the running initiative. Yeah. I think going forwards, what I hope for the plan going forwards is, I suppose, for us to continue to develop and strengthen. We're very excited that we've developed in collaboration with UL and working with post-primary schools a new active school flag initiative for the post-primary sector, very different because it's a very different setting, and based solidly. It promotes physical activity for well-being, anchored by student voice and student leadership using a whole of school approach. So we're excited about that. And if I can finish by saying, the other thing we're excited about is looking forward to future collaboration. So in the past, we've had a really good collaboration. We have an ongoing really good collaboration with Get Ireland Walking, in that active school walkway routes on the school premises is a key part of what we do with schools. And again, that walkway has become not just a physical activity track, but an outdoor teaching and learning facility as well. We'd had very successful collaboration with the Olympic Federation in terms of a movement break 2 years ago, with the Irish Heart Foundation last year. And I think the resources that we're providing schools with for this skipping initiative and the past one includes tutorial videos. There's a standalone tutorial video called Including Everyone, which gives advice specifically for children with additional needs, because they're part and parcel of our schools, and the worst possible thing to do is have a physical activity initiative and children sitting on the side. And so we collaborated there and benefited hugely from the advice of Active Disability Ireland, Vision Support Ireland, Irish Wheelchair Association. So I guess I'm excited going forward about future collaborations. And I think what we bring to the table is that we know how schools work, and we know the type of supports that schools need, and we know how to fit things into the school day. So yeah, we're excited about the future and the new framework and plan.
No, and it's fantastic, I suppose, to hear, I suppose, the really strong work that's happening in the school sector from yourselves, and also, I suppose, that focus around supporting the school space with infrastructure from Sarah, because I suppose we know from the CISPA studies and that like really, you know, the levels of physical activity or sufficient physical activity in our children and young people are quite low, and really, you know, that level, or that level of engagement in physical activity that we have as we go through childhood into teenage years, early adulthood, that's almost our peak spot, and so we need to get people really active at that point, so as they drop off naturally through age and whatever, that we were starting from a higher base. Before I bring Colin back in, I might come back to you, Sarah Taylor, because I know I just moved on to Karen, because there was a nice synergy between what you were saying in education and the work that she was doing. But I know you've got some new stuff coming up in the active travel space as well.
Yeah, absolutely. I suppose up to now, our infrastructure, we've been kind of doing a lot of investing in kind of urban areas, and I'd say from the layperson is looking going, these are all separate projects, what's going on, you know. So our focus now in the next 5 years is really to start creating these networks of active travel infrastructure, so that people can really see themselves going from A to B to C without having to juggle on and off infrastructure and everything, negotiate conjunctions, things like that. And as well as that, you know, the integration with other transport modes as well, you know, so for the longer journeys, you know, the last mile can be walking, cycling, just even getting that little bit of physical activity in as part of your daily routine will help achieve, you know, the targets, the daily targets for everyone. You know, we do want to also look more into that behavioural change space as well, because I know that there's a cohort of people there that, you know, for even if you had a cycle lane from their front door to the front door of their work, they're not going to hop on a bike. So we need to start giving people the confidence and the capacity to say, okay, maybe this is for me. So just
so watch out for your next the active travel network coming to an area.
That's it. Keep an eye
out. So Colin, can I just bring you back in, because I suppose in terms of your presentation, the work that has been ongoing for the last number of years, and people's ambitions or hopes for the next framework, I suppose collaboration and connection is really key, and I suppose my key question to you, very short answer is, are there challenging times ahead when it comes to that?
Yeah, thanks, Sarah. I suppose firstly, just briefly, I think it's really encouraging that everybody who spoke during this discussion has highlighted that collaboration piece. I think if we look at the likes of Active Schools, which I think is a wonderful exemplar of sectors coming together, you see, you know, the Department of Health, the Department of Education and Youth, and we're bringing in the Department of Culture, Communications and Sport in that space as well. If you look at what Sarah's talking about in terms of those active travel collaborations, you're looking at how your local authorities and your, you know, transport infrastructure link up. Similarly, when Louise talks about, you know, the role of the local authorities, the local sports plans, I think it's crucial. And my own feeling would be that is very much the next space that all of this needs to go. We're looking at, I suppose, you know, to date, a range of communications campaigns promoting physical activity that are operated by a particular actor or a particular sector, and they have a particular message with that focus and they do their thing, and that's great. There's a lot of international evidence that if you collaborate better on that and build a picture of physical activity in a more holistic way, that, you know, it's not just the, you know, your hour of sport or whatever it might be, that there's all these little opportunities of physical activity. And the more we can all, I suppose, collaborate on building that message, then, you know, we can all, I suppose, our message can resonate each other's messages. We're all looking for the same thing here. And I suppose that's one of the real challenges in terms of de-siloing this and having that more closely coordinated work across the sectors. I think having the long-term vision under the framework where all the different actors have committed to being part of this is very useful, because you may have sectors where there's a particular challenge this year or resources are tight or whatever it is, but that long-term commitment is going to be crucial if we're going to address this.
Yeah.
And that's going to involve lots of different population cohorts and lots of different solutions.
Absolutely. And I will say, Colin, there's lots of suggestion for policy initiatives in the Q&A there, and definitely thank you everybody who's engaging. Also lots of you know, reference to initiatives that different organizations are doing and delivering. So lots of food for thought. So look, I thank you very much, Louise, Sarah, Karen, and Colin for that chat. I'm now going to introduce Blóithín Casey, who works with me on the Health Eating Active Living program. Blóithín has a background as a physio and also in research, and for the last while her focus has been on our developing our physical activity pathways in healthcare model and supporting the implementation of it. Over to you, Blóithín.
Cheers. Thank you, Sarah. So as Sarah said, my own name is Blóithín. I'm project manager with the Health Eating Active Living program. And over the next 20 minutes, going to aim to show you some of the work we've been doing to try to support you to be able to make every move count. So just before we go into the main piece of the presentation, I'll be speaking about these terms, the PAF and the PAFM. So the PAF, a physical activity pathway, just to set the scene, and lots of you in the call are probably aware of what a physical activity pathway is. But just to remind ourselves, a physical activity pathway in healthcare is a set of steps a healthcare professional can take to encourage or support a patient to become more active. And those steps are aligned to the MEC steps, or making every contact count framework. So wherein as a healthcare professional, you have a conversation, you screen for physical activity levels, you then will intervene, whether that be with brief advice, brief intervention, extended brief intervention. There's then active participation, whether that be through signposting or referral, primarily external to the HSE. And then there's a review and a follow-up. And then when we speak about a PAFM, or physical activity pathway and healthcare model, what that is, that's essentially the steps or the organizational enablers that we need to do within the health service to build capacity for you as healthcare professionals to be able to implement a physical activity pathway in your clinical practice. And we published our physical activity pathway model document at the end of last year. If anyone wants some light bedtime reading, I know we have no traitors this evening. You can scan the QR code there and read the model document later, and a link I think is going to be put into the chat there now as well. But essentially that model document details 10 recommendations and 24 actions over a 5-year period, that essentially will plan and guide and focus our work towards implementing a national physical activity pathway in HSE. There's a strong focus on collaboration in our work. Not all of those actions and recommendations are owned and sit with us in the Healthy Eating Active Living programme. Other colleagues and collaborations within HSE, but also external to the HSE, including work with Louise in Sport Ireland in the Physical Activity for Health Officer initiative, and Colin and the department in the Every Move Counts comms work as well. So in this presentation, I'm going to provide you an update on 2 of the 10 recommendations, and the first is recommendation 7. And recommendation 7 is providing physical activity information and behaviour change support via the recently launched HSE app and HSE.ie. And the action here from last year through to 2029 is to develop content and a behaviour change support programme offering on HSE.ie and the HSE app. And in our model document, this is the figure and the vision that we had in terms of the digital platform offering that would underpin a physical activity pathway. Especially, I guess, acknowledging that this is a national piece and we need it to be scalable, and the role of digital and being able to support being able to do that. So the first purple box where brief intervention happens, a healthcare professional signposts someone into the digital platform. So you can see here the HSE app behaviour change support programme, and I'll detail what that is in a couple of slides time. But ultimately that then people enter leave that programme, enter the green space of building capacity to be independently active in their communities. But people can also self-refer into the digital space, and also come into the digital space through those blue boxes, which is what we call our Tier 1 services, or your clinically supervised structured rehabilitation. So things like your cardiac or pulmonary rehab. So upon discharge from those services, be signposted into this digital space. So I've mentioned the HSE app and this digital space. There's a wider strategic piece in HSE around that through the publication of the HSE's digital strategy and the digital health strategic implementation roadmap. For those of you that aren't aware, the HSE app was launched earlier in the year by the Minister of Health in February. And last month saw version 3 of the app being launched, and our colleagues in tobacco brought quit to that version 3 of the app last month as well. We were delighted to be brought on board to work with the HSE app and digital team in April earlier this year to be able to bring the vision that was on the previous slide to life through HSE app and HSE.ie. So when I present what that vision is, sometimes it's easier to describe that through personas. So I'll bring you through a couple of different personas and what the digital offering or space on HSE app or HSE.ie will do for each of those personas. So the first is someone who's somewhat active. So this person is engaging in physical activity, perhaps is being active 2 days a week, but not meeting that threshold of meeting the national guidelines. This person may not have had a conversation with a healthcare professional about wanting to become more active, maybe sees the HSE are doing something around exercise and physical activity. They see an advert or hear something on the radio, or perhaps from a friend. This person has a level of motivation that they want to become more active. So they don't necessarily want to enter a structured program, but want access to exercise videos, or maybe want to know where to be active in their area. So for this person, perhaps the digital offering is providing them with access to a library or repository of exercise videos, or perhaps signposting them to what Louise spoke about, the Get Ireland Active data repository. So where to find spaces and trails of where to be active in their area, or maybe linking them to their local sports partnership finder as well to find their local sports partnership. For persona number 2, This is someone who's not active, so either active 0 days or 1 day, and they may or may not be living with a chronic condition. And this person perhaps has had a conversation with their healthcare professional through a Making Every Contact Count conversation. The topic has been raised around physical activity, and the person has said that they'd like to become more active, but they need more support. And that's the difference between this person and person one. They have a level of motivation, but need more support. So for this person, they're signposted into a supported behaviour change program that's offered on the HSE app and HSE.ie. And we'll speak and show you what that program looks like in the next slide. And then persona 3 represents people who are presenting in the HSE's digital space for probably another reason other than physical activity or exercise. So the pregnant woman here is being used in this case because maternity care appointments are being managed on the HSE app at the minute. So perhaps there's an opportunistic space to be able to prompt exercise and physical activity content to those people who are presenting in this digital space or in the app for another reason. For personas 1 and personas 3, the current app version is meeting the need of having content for both of these personas at the minute. So we have a number of exercise videos, we have signposting to your local sports partnership and the Get Ireland Active website. Perhaps in future versions, what needs to be improved here is what I was speaking to on the pregnant woman journey, kind of more of that nudging or prompting, making the content less static. But what we've been working mostly on over the last number of months since we began with the app team in April is developing out that behaviour change support programme for persona 2, so someone who's inactive. And that programme is called the Get Active programme, and I'm just going to play a short promo clip for that programme now.
Are you ready to move more and become more active? The Get Active program is here to help you get started. Over 10 weeks, you'll be guided to gradually increase your physical activity. You'll enjoy a walking program, strengthening exercises, and simple tips and tricks to keep you motivated every day. Plus, when you sign up, you'll receive a Get Active pack in the post with everything you need to support your journey, including resistance bands, a step counter to track your movement, and printed materials. Join us online and take the first step towards a healthier you. Let's get active together.
So that is our HSE's Get Active programme. Still, so not launched yet, and I'll speak to the launch in a little bit. Here you can see some prototypes of the app page, and I'll bring us through a short clip of the prototype and what's involved in the programme next. But just in terms of the target users of this version 1 of this programme is adults over 18, those who are inactive and somewhat active. There's 2 different programme offerings. It's for people who are independently mobile, so with at most a unilateral or one-sided aid, and those living with and without a chronic condition. Just to note as well, people can self-refer into the programme, or also be clinician signposted. In version 1, it is completely digitally led in that we don't have a human support feature. And for those that come into the programme through onboarding and are deemed either too active or not suitable in terms of their mobility levels, they will be provided further signposting to relevant information. So I'll bring you through the current prototype of the programme on the app. And again, just to highlight, this is a prototype and we're still in testing and development phases. So when this is showing it on the app, and it sits under the services function on the app. You'll be provided with information as to who the programme is for, who it's not for, and be provided some information around to read about how your health has been in the last 6 months, whether you're appropriate for the programme, and you'll come into onboarding where there's 5 questions. The first around your current activity levels, and that's to help us decide whether you're going to be in that inactive or the somewhat active programme. You'll then be asked to set some goals. So why do you want to get active? And completing those, you'll then select a start date. You can choose to start the programme there and then, or in a future date, and then you'll be brought through to order your pack that you saw in the promo clip there, and that's linked through healthpromotion.ie. And the final page is just asking you questions around how you want to receive your notifications. You'll get to review your details. If anything's incorrect, you can go back and edit that, and you'll submit. So you're then through to the programme. This prototype here is just showing what it might look like in your dashboard in week 4 of the programme. So you've got a dashboard each week that'll tell you what you need to do. So it's a mixed graded walking programme, strength-based exercises, and an education piece. So this week's education is all around setting goals.
Setting goals. Setting goals for exercise is a great way to stay motivated and track your progress. People who set goals are more active and they stay active for longer. Make your goals SMART. SMART stands for specific, measurable, achievable, relevant, time-bound. Specific means...
So, and each week there's new education content based on behaviour change research and literature around the education components required in a 10-week programme. This is the strength-based session. You can watch the video through as a class with our 2 instructors.
Welcome to the Get Active Strength session.
We're your exercise instructors. My name is Matthew.
My name is Susan. Let's get active together.
You can choose to watch the strength session through start to finish in that class session, or else we've got the components of the strength session broken up into demo clips as well, if you want to kind of break them up into snack bite kind of pieces throughout the week as well. And then I think the last function, just to show on this prototype, is that you can go back and view previous weeks, or if you've kind of missed a week, whether that be due to ill health or just need to go back and repeat a week for whatever reason, you'll have the functionality to be able to do that as well. So that is the Get Active programme. Next steps for us, I suppose the big piece is getting it out there. So this is our first time presenting on it. So that's part of the puzzle, but we do need to continue with the testing and development and officially launch that. And we'll be coming out on version 4 of the HSE app. So we won't be the only product or new product coming out in that version. So I think the planned launch for that is Q1 26. Other next steps around this is just to recognise this is a digital first offering of the Get Active programme, but it won't be digital only. So working on an offline offering and extending the programme to other population groups and exploring that feasibility of what might be required to integrate a human support or health coaching aspect into future versions as well. But really our focus in 26 will be the launch of V1, version 1, implementing that and gathering preliminary evaluation data. And then just to finish up, just 2 or 3 minutes on this recommendation, recommendation 8 around developing national specifications for local exercise referral scheme programs. So just as a background, local exercise referral scheme programs, we call them tier 2 services or programs in our physical activity pathway model. And those tier 2 services, they sit below tier 1 services. So your structured, your clinically supervised rehabilitation. So tier 2 they don't require clinical supervision, and they're the services that we in HSE tend to commission out a lot into the community. And because of that, because we do a lot of commissioning in that space, we have developed commissioning standards that aim to provide guidance on the development and the delivery and commissioning of those types of programs. And that's currently in draft. But just what I want to draw your attention to today in doing that work, we recognised a gap from both our exercise professional colleagues in the community and our own colleagues in HSE for a need for more guidance on medical clearance. So we have in this document been able to put a statement in on that. So for example, a big piece there that where a healthcare professional is referring someone to an exercise referral type service or these tier 2 services, we can say that does and should imply medical clearance and remove the need for further pre-participation screening or guidance by the exercise provider. Of course, there'll be case-by-case situations, but for the most part, where a healthcare professional has referred someone to a structured physical activity program in the community, that does imply medical clearance. But to support our healthcare professionals to be able to make those decisions and our exercise professional colleagues out in the ground delivering these programs, we have been working on the development of exercise referral decision tools. So this is an example of one for our healthcare professionals, but we also have another slightly different version for our exercise professional colleagues as well. These are in draft. There's nothing wild or new or wonderful in these. They're based off the American College of Sports Medicine's guidelines, wherein we start by recognising, is the person active, are they not? And then based on whether the person has active signs and symptoms or any absolute contraindications to exercise, what type of programme offering should they be signposted or either referred to. So the last part of the decision tree is whether you signpost someone to our online Get Active programme, you signpost them to a community-based opportunity, or perhaps they need to be referred to a tier 1 clinically supervised rehabilitation service. So with those two pieces of work, they're currently under review. You saw the little draft icons, but we're close to sign off. They're getting sign off by the clinical programs, but with the plan to have those both published by year end. And just my last slide then, that was only 2 of our recommendations in our physical activity for health model document. There's 8 others, some of those represented by the jigsaw puzzle pieces here, some sitting with us and others not. So our colleagues in MEC and our colleagues in Sport Ireland around the Physical Activity for Health Officer initiative. But really exciting space and kind of all the jigsaw pieces starting to come together. For any more information and anything got to do with the Physical Activity Pathways project, they're my own contact details there on the screen. But thank you.
Brilliant. Thanks a million, Bláithín. That was great. And I think people were obviously listening very intently. There's not a huge amount of questions into the Q&A, but there are a few comments and questions in that I might just pick up on, I suppose. Some great suggestions in from people in terms of, you know, how we might work and better connect to support people into this digital space, whether it's working with older person advocacy groups or that. Great to have those ideas. They're on our list at the moment. As Bláithín said, our focus is on getting this live and once it's out in the world or born, as we're considering it, we will be definitely looking at all of those pieces. And as I said, look, we recognize that this is digital first. It is one part of a jigsaw. There is already a huge amount of work going on, and Louise from Sport Ireland referred to it earlier through local sports partnerships and lots of other local organisations that have in real life opportunities for people to engage, be active, and get those kind of wider social benefits of physical activity as well. So it's an important project, but it's not the only thing we're looking at in this space. So I suppose just to say thank you very much. We're coming to the end of our time. I'd like to say thank you very much to all of you for joining us today. Hopefully you found it interesting, got some new information, or got more energized around working to promote physical activity. We do hope to have some of these more frequently as well. I'd also like to say a big thank you to Colin, Louise, Karen, and Sarah Taylor for your time this afternoon, for coming and sharing your insights. And I'm sure you've read all those suggestions in the Q&A for policy suggestions around subsidising access to physical activity opportunities, and other suggestions that were there. I'd like to thank our colleagues in IMS for all the technical support, and we shall leave you, get back to your day. Hopefully you will get to enjoy some movement this afternoon. Goodbye.
Physical activity guidelines for people living with chronic conditions. Regular physical activity is one of the best ways to improve your health, and it's safe. The risks of not being active are higher than being active. Ireland's physical activity guidelines for people living with a chronic condition include moderate intensity aerobic activity such as walking, cycling and swimming, muscle strengthening exercises at least 2 days a week, and limiting sedentary behaviour. You should do 2 hours and 30 minutes of moderate intensity aerobic activity each week. Moderate intensity activity is when your breathing and heart rate increase, but you can still talk. Muscle strengthening exercises can include Pilates, yoga, exercise classes, gardening. It's also important to limit your sedentary behaviour. Replacing time spent sitting down with any form of physical activity benefits your health. If you can't meet these guidelines yet, that's okay. Just do as much as you can manage. Most people with chronic conditions don't need medical advice before starting light or moderate activity, but if you experience warning signs, stop and talk to your doctor or nurse. This might include chest pain, breathlessness, dizziness, or extreme tiredness. Start slowly and listen to your body. Every move counts.